everyone. Welcome back to the Untold, your show that's all about meeting new people, learning from them, hearing their stories. And today is a very important episode.
Today is about mental health.
Mental health care, and we
And
have a great guest.
He's one of the best in his field.
Yes.
I'm really glad we're gonna have this. We might have a little teeny tiny therapy session,
Yes,
like in the
and
middle
we
of
need
this.
it, trust
We need
me.
it. We all need it.
But
It's
let's not waste time.
And let's not
'cause
be ashamed of it. That's my
always.
never be ashamed
Never
of
be
needing
ashamed.
help. Anyway, let's not waste time.
Yes.
Let's meet our guest, Dr. Mohamad Alsuwaidan, right after the break.
We're back on the Untold, being joined by our very special guest, Dr. Mohamad Alsuwaidan. Welcome to the show.
Thank you so much for having me.
Welcome to the show, doctor.
Thank you so much.
So let's start with a brief about yourself. I mean, before becoming a doctor, tell us about yourself.
Okay, so I was always interested in science. I grew up in the US, as maybe you can hear in my accent, and then moved to Kuwait in high school, at the end of high school. And I was always interested in science. I finished high school. A lot of people think, seeing me today, that I always knew I wanted to be a psychiatrist. But in fact, I didn't even know I wanted to be a doctor until 12th grade. I knew I wanted to do something in the sciences, and I was a people person. And I had high grades, and I thought, well, high grades, it gets me into medicine. I'm a people person. Medicine has science. I'll do that. And then after going to medicine, I never knew I wanted to be a psychiatrist until I had done the different rotations in medical school. You go through gastroenterology and obstetrics,
So you did
gynecology, and
general
so
med
on.
first.
Yeah, so I
did
did
general
medicine.
med first, yeah.
I graduated with a degree, an MD in medicine and surgery.
But you had no clue what you wanted to specialize in throughout your
knew-
studying process.
Well, as soon as I started learning about the brain, I knew I wanted to do a brain specialty.
Okay.
And I thought I wanted to be a neurosurgeon, a brain surgeon, because I thought brain specialty, what's the hardest thing I can do? Brain surgery. But I actually, when I did my rotation brain surgery, I didn't like the outcomes.
Right.
It's a very difficult lifestyle in terms of you spend your life at the hospital. And then when I met my first psychiatric patient, it was a patient who had bipolar disorder. I was fascinated because I thought, what are these changes that are happening in the human brain? This, tiny computer that controls our emotions and our cognition and our behavior and our movement, that can change the whole outlook of this person and their emotions and the way they interact just by some neurochemical signaling. And so at that point, I was hooked on learning more about the brain emotionally, and then also about mood disorders specifically, which is what I specialized in after doing my psychiatry residency training. So I went to Canada at the University of Toronto. I did my 5 years of psychiatry. So it's a long process to become a psychiatrist, even at a starting point. So 7 years med school, 1 year internship, 5 years of psychiatry training. Wow. So it's 13 years.
That's extensive.
It is. And then,
very extensive.
and that's just to be a junior psychiatrist.
Yeah.
And then I did some advanced specialty training in mood disorders, anxiety disorders, and a master's of public health. So did 16 years of training, and then came back, taught at 16 years. Yeah. Yeah, but the nice thing with medicine is a lot of those years are practical.
Right.
So you're working and training at the same time.
Yeah.
I came back. I worked at Kuwait University Medical School, taught students at the Ministry of Health. I was head of the mood disorders program at the psychiatry hospital.
Mood disorders program?
Yeah, so we often divide things into specialty units. So, for example, old age psychiatry, addiction psychiatry, women's mental health. So one of those divisions is mood and anxiety disorders.
I love how there's a women's mental health. Like there's a section specially for us.
Because there are some specific issues. For example, postpartum depression. It's a very unique presentation of depression. It happens right after delivering a baby, and often women have unique needs because they might be breastfeeding, so they can't take every kind of treatment. So there are psychiatrists specialized in that area. And so I specialized in mood and anxiety disorders, and we started a specialty program at the psychiatry hospital in that area. So that would be things like depression, bipolar, OCD, generalized anxiety, panic attacks, social phobia. Those were things I'm, if you will, subspecialized in. Although I do general psychiatry as well. And then I started a small private practice, which eventually grew and now has become the biggest private psychiatry center in the country. And I spend most of my time seeing patients, but then also doing public events and talks and working on social media with the goal of increasing mental health literacy, if you will. I think in many societies across the world, and especially in Eastern societies, the level of health literacy, and especially the mental health literacy, is very low.
True.
And the solution is education. And so we need to
Absolutely.
educate
Awareness.
people, awareness and education where people are
And the thing is, most people relate, like, let's say, mental health to religion, which is, I think, it's quite wrong. Like, if you're feeling depressed, oh, just go pray. I mean, we pray,
Yes.
but you can still get depression. It's
Of
not
course.
related to anything.
Yeah, we always say when you get a mental illness, it's nothing about what you did or your values or your religion or your adherence to
It's
religion.
sickness.
It is. It's an illness like
an illness.
diabetes or high
Right,
blood
right.
pressure or so on. Now, of course, life events can affect you. So being isolated or using substances that are toxic to you or having trauma can affect the emergence of a mental illness. But a big portion is genetic as well, just like diabetes, just like heart disease.
Genetics.
Yes. Now, just coming back to the religion question, we never bring that up with patients. Having said that, there are lots of studies showing that spirituality in general, whatever religion
Right.
that person adheres to,
Does count.
the sense of being connected to a power greater than oneself, to put it in very general terms, does give a human being a sense of calm and, it's very meditative.
It's
That is very,
incredible.
very true. Well, with our talk, we're touching on the topic of mental health care being stigmatized in the Middle East, especially.
Yes.
It's very stigmatized. Maybe not today as much as it was years ago, but when you decided to become a psychiatrist, did you face any stigma? Because even studying that
Yeah.
subject is stigmatized.
It's very interesting. One of the comments I got from family members, and on my father's side of the family, I'm the only physician. There's a couple of dentists, but I'm the only physician, and so there was a lot of hope on me. Like, oh, you're the first of this generation to be a doctor.
Right.
And I remember one family member told me, after all that, and
You're gonna become
yeah,
not a real doctor
he actually
to them.
said you're throwing away your career,
Throwing away your
career to become a psychiatrist.
Do you know how important psychiatrists and
Yeah.
therapists
But the
are?
awareness wasn't there at
The
the time.
awareness wasn't
The
there.
funny thing is, this family member, who I love, by the way, I'm very close to him. He refers me a lot of people now.
Oh,
And I think he
wow,
realizes
how the tables have turned.
exactly. But it's education. It's
It
just
is,
not
it
realizing.
Why did we even start with the stigma in our culture? Why do you think we had the stigma?
I don't think it's unique to our culture. If you look at stigma, it's actually worldwide. And in my view, there's two causes to stigma. One, there was a very dark age to mental health practice and psychiatry, just like there was a dark age in surgery.
Right.
If you looked at how surgical practice was back in the day, you would never want to go to a surgeon.
Barbaric.
It was barbaric,
Yeah.
but it was the cutting edge at the time. And I guess that's the nature of history, right? We might look back 200 years from now and say what we were doing now, if not barbaric, at least was misguided. But what we see, we saw back in those days, electric shock therapy without anesthesia,
There you go.
ice baths,
There you go.
coma therapy, insulin coma
Yeah,
therapy.
yeah.
But is electric shock therapy effective?
Yeah, I'll come back to that. But what you saw was people being put in asylums and so on. That created a stigma that took many, many years to.
Why was there an extreme approach to those cases back then?
Because there was no other solution, right? And people were sick. And
I
so
think
if you
people are
actually look.
afraid.
Afraid of the mentally ill, and so they would put them in asylums, which were almost like prisons.
Right.
And one of the turning points in the history of psychiatry worldwide was a man named Philippe Pinel. He was a French psychiatrist, and what he did was he was the first to release mental ill patients from the asylums. There's a famous painting of him in Paris where it's a large oil painting showing him as a hero breaking the chains of mental health patients
Beautiful.
from their prisons, basically. So that was part of the stigma. The other part was media. So
It's
there was
always the media. isn't it?
there was
Always the
there was a
media.
time when media always portrayed mental health very negatively. A mentally ill patient is dangerous, as a psychiatrist or psychologist is wacko, and that changed. When that changed in the media and the practice of psychiatry and psychology improved, there was at least an opening for stigma to decrease, and now we need to get people to that awareness. Why do we focus on Eastern societies such as the Middle East? Well, that stigma was also there in the West, but they had 20, 30 years of mental health awareness programs prior to us. And so we're just catching up now.
Catching up.
Yeah.
That
I
is
think
true.
fear leads people to extreme measures, but
In general, yes.
yeah.
Yeah.
But again, we were talking about
Stigma.
No, using
Electric shock
shocks.
therapy.
Right,
Yeah.
Does it really work?
Yeah, it
So-
was a treatment for psychosis.
Still
wasn't
is.
it?
Still
Right?
is.
Still is.
Yeah. So the idea of electroconvulsive therapy, that's the official name, electroconvulsive therapy, ECT. It's a form of brain stimulation. So the idea is the brain is a big computer. And, when we intervene with medications, you're resetting the chemical messaging, because the way the brain works different than a computer is it's electrochemical signaling, whereas a computer is only electrical. So you can modify the signaling in the brain using chemicals such as medication, but also you can use energy such as electricity. So if you apply that energy to the brain, you can basically reset networks in the brain and patients improve. And it's still used today, but in a very different way. In the past, there was no anesthesia. So now a person is anesthetized when they're having the ECT. There was no muscle relaxants. So you don't even see a seizure anymore.
And you only do that treatment if it's the extreme case.
It's someone who has absolutely not only medication,
cases.
but better brain stimulation. So for example, now there's forms of brain stimulation that involve magnets. That doesn't involve convulsions or having seizures. It's very precise. And that works. And we have it in Kuwait, and it works very well for depression and OCD, for example. Extreme cases of depression, we can still use ECT, but it's rare now.
But some people don't believe in the use of medication. They believe in, let's say, talkative therapy. You can just talk it through.
Yeah.
Which method do you prefer?
It's neither this or that. It would be like saying, if I was an orthopedic surgeon, we would say some people believe in surgery and some people believe in physiotherapy. A good orthopedic surgeon would say that's a false dichotomy. It's neither this or it's both.
Depending on the case.
It's depending on the case, and it's often both, right? So, for a severely mental ill patient, they might need medication for some time and therapy as well as a bridge. For someone who has a mild condition, they might need therapy only.
It depends on how
serious the case is, what the diagnosis is, I would put it this way: most people would benefit from therapy. Some people would benefit from biological interventions like medication or brain stimulation.
But aren't these medications addictive?
Very, very few medications are addictive. Almost, 95% of psychiatric medications are not addictive. There are a group of medications called the benzodiazepines, like relaxants. They can be addictive, and so most psychiatrists won't use them, or they'll use them very short term for an acute situation and stop very quickly. But if we talk about antidepressants, antipsychotics, mood stabilizers, they're not addictive. No.
They're not.
Right.
No.
We have a question about lobotomy.
Okay.
We're
going way back.
Yeah, we're going way back. Why did they use it?
Yeah.
That's extreme from the image I'm seeing right now.
Is it Harvey Cushing or? That is Harvey Cushing. Yeah. So Harvey Cushing was a neurosurgeon, and he used this approach where they go through the nose and they basically break up the frontal lobe. And it was a barbaric practice.
What are we trying to treat with that?
So if you actually look at the history of that never came from psychiatry. That came from neurosurgery, brain surgery.
Okay.
Harvey Cushing was a brain surgeon, not a psychiatrist.
Do they still apply things like this nowadays?
No, never. I mean, it was proven to be.
What is it treating though?
It doesn't treat anything.
It doesn't treat anything.
Yeah.
What
were they trying?
He was trying to basically apply almost like a permanent sedation, permanent sedation to a person who's very aggressive, like someone who has schizophrenia or bipolar, where there was no medication treatment for, and so just get them to become almost like vegetables.
Which some meds do turn people.
And by the way, the American Psychiatric Association, even at the time, criticized the practice.
Interesting.
But people associate it with psychiatry, even though it was a neurosurgical practice. It was a fringe neurosurgical practice by Harvey Cushing and his team.
Interesting.
Yeah.
I think it's all the experiments that was happening by the time. But first, let's take a break.
Yeah, we got lots to talk about. We'll take a break.
Right after the break.
Yeah.
So we're back again with our guest, Dr. Mohamad Alsuwaidan. So before the break, we were talking about extreme measures or experiments when it comes to, curing mental diseases. So even that at that time, you probably studied all of that. What made you want to still go on the path of becoming a psychiatrist? I mean, it involves stress. It involves a lot of, treating patients with incredible diseases, I'm sure, but doesn't that affect you personally?
Well, so I guess there's two parts to that. The first part is those aspects of lobotomies, ECT without anesthesia, and so on. That was never something I studied. Those were long gone before the 1970s. So
thank God.
Yeah, and so for me, going to psychiatry, it was a very exciting time to go into psychiatry if you were interested in brain science, because new treatments were emerging, whether medication or brain stimulation, and still are, that are at the cutting edge, if not, if you will, the bleeding edge of medicine in general. Most research dollars in medicine today are going towards neurosciences. If you look at, for example, the major funder of science in the world today is the United States. The United States has had 3 moonshot projects in science in the span of the history of the U.S. All started under Democratic presidents. So it was first the quest to put a man on the moon under John F. Kennedy. That was the first big scientific moonshot project. The second was under Bill Clinton with the Human Genome Project, matching the human genome. And the third, a lot of people don't know this, was launched under Barack Obama, which was the BRAIN Project.
The BRAIN Project.
And the BRAIN Project stands for Brain Research Through Applied Innovative Neurotechnology. It's a backronym, if you will.
Okay.
Yeah, and so they put a lot of money back. This was, I think, in the midway through Obama's maybe the end of his first presidency into the second term. Huge amount of research money, similar to the Human Genome Project or the quest to put a man on the moon, into brain research. So it was a great time to go into psychiatry. Now, the second part of your question is the aspects that the toll it takes on a person. Now, medicine in general takes a toll on a person. If I was an oncologist, a doctor who treats cancer, that takes a huge toll.
I think for you, listening to patients, their stories, their depression, everything, it takes a toll on you.
So I think there's 2 levels. One, once you sign up to become a doctor, you've already signed up that, look, your profession takes a toll. Within psychiatry, you're absolutely correct. I would say the biggest toll is for lack of a better term, the secret keeping. And so
my conversations are not confidential.
So that's the biggest toll, because that weighs on you a lot. I mean, you hear difficult things, and you can never talk to them about to anyone.
People go to therapy. What do therapists do when they feel?
So what therapists do is it depends. It depends, psychiatry or therapy. But in the end, during your time of training, you go through a training about how to deal with the stress.
Okay.
I remember taking a course called Physician Heal Thyself at the University of Toronto. And so we were trained actually, how do you reach a balance so that you don't burn out? And there's lots of tricks and tips to the trade. Some that every person should do, like exercising, sleeping well, eating well, surrounding yourself with positive and non-toxic relationships, taking many vacations as opposed to one large vacation, but many vacations throughout the year. But then also having Hillary Clinton famously said it takes a village. So having a village around you of colleagues who could be also your mentors and caretakers, and you won't necessarily disclose aspects of your patients to them unless they're also taking care of that same patient. But it suffices to have that kind of collegial and emotional support. And then I think it's also important to have some form of hobby where you let go. One of the tricks I use is in lots of countries, but also especially in Kuwait, even when you're not in clinic, people call you out of respect, or sometimes just as a nickname, Doc. Hey, Doc. And it's something my friends know that I don't like.
You don't like?
I don't like it at all. And the reason I don't like it...
I got it from Looney Tunes. Bugs Bunny calls you Doc,
But for me,
why do you don't like it?
It's a tool. It's a tool I've used to separate myself from that persona. So it's almost like when I enter the clinic, it's almost like I'm putting on a cape, I guess the white coat. I don't wear a white coat, and it's then I've become Dr. Mohamad. And then when I leave the clinic, I don't want anyone calling me doctor, because
I want me to even refer to you as doctor.
Well, I guess in a presentation or formal interview, but in general, yes.
In general,
my
you don't
friends,
want to be addressed. You want to live your life normally, and
I want to be a civilian.
Exactly. At that point. And that's a mental trick that helps me to separate.
It's like celebrities not wanting to be celebrities, but wanting to do the movie parts.
Something like that. I guess. Yeah. I guess the difference is the huge amount of responsibility you have with that title.
Exactly. What are the most common misconceptions about mental health care?
Well, with some of them we talked about, which is barbaric treatments are still used, medications are addictive, so that's very common. One common one is that if I go to a psychiatrist, I'm going to be labeled as crazy, I won't be able to get married, I won't get a job.
That's probably in the Gulf region.
It goes around. Do we have privacy in Kuwait when we go to mental health care?
Absolutely. So,
because that's a big misconception.
By law.
People think everyone will know your business.
So if
the government, I guess if you go to a government hospital, they will know.
That's also not true. So by law in Kuwait, if someone breaks your confidentiality, you can sue them and you will win. You will So it's a done deal. Having said that, there are specific categories where the law allows for information to be disclosed for the public safety and public good. And usually that's things that are involve
Serial killer?
a person having a weapon. So working for the police force or the army or being an airline pilot or a judge.
You can't go for those jobs, right?
If you have specific diagnoses. Yeah, not any. Like if someone has a marriage problem and goes for therapy or counseling.
That doesn't warrant.
No.
Okay.
But if someone has, let's say, paranoid schizophrenia.
Okay.
It's not smart to own a gun, right? Or
Right.
to be in a job where you're carrying a gun.
Would they be allowed to purchase guns in the States?
I actually don't know. I think the rules
different state to state.
different
That's
state to
true,
state. But
that's
I think
true.
in general, there's been
In
a lot of
general?
awareness in the States that someone who has a criminal or mental health record for serious
Would not
mental illness
be
should not
able
be able
to-
to buy a
okay,
weapon. Yeah.
okay.
So nowadays we hear a lot about mental issues. There's a lot of sick people. Why do you think that increased? Is it because the increased awareness that people know about this, so everyone just assumes they're sick, or is it because of the lifestyle that we have nowadays, the pressure that the society puts, and especially with media, technology, etc.
I mean, the statistics do show that we have a bigger number.
Yeah.
So sometimes, the saying that there's lies, damn lies, and statistics. Have you heard that saying?
Yeah.
So statistics can be modified to
Portray a certain narrative.
Right. So, for example, and I've used this example before, when the American Heart Association changed the definition of high blood pressure, they made it to a lower number. Obviously, there were public health reasons for that because they wanted to catch blood pressure earlier. Overnight, once that definition was changed, millions of people who didn't have high blood pressure suddenly had high blood pressure because the
number
cutoff changed.
Oh,
Right.
okay.
And so there's something to that in mental health, which is as the definitions became clearer and there's ways to define mental illness and they became tighter and tighter over time, then certain disease classifications increased. Awareness made a difference. So I think a lot of what we see today was always there. People just would never go to a psychiatrist or
They
psychologist.
never admit that they had it.
Not know. Sometimes not even admitting. There's a lack of awareness. So
True.
for me, there's a difference between denial, which you know and you don't go, and that exists. But more of what I see is, I don't even have a language or
I don't even
an
know what's
awareness.
Yeah.
And so, one of the common reactions that happens to me in clinic is when someone comes to me and describes a set of symptoms, and I say, you have this. Let's say I say, you have panic disorder or panic attacks. You see this like light bulb moments. It's like these 20 symptoms that I had, they have one name, and that's almost like half the treatment. I think that's what made the difference in people having more diagnosis. I actually don't think a lot of people label themselves as mentally ill and they're just kind of faking it or trying to get a label. I think it's the awareness.
I think most common disease with teenagers nowadays are, accepting their body, accepting their image.
Body image, yeah.
Yeah, body or, image in general. Where do you think that comes from? Why do kids nowadays are affected by these, these terms? And I didn't even know these terms existed when I was a kid. I wouldn't like the way I look, but I wouldn't say I have body dysphoria or whatever.
Body dysmorphic disorder or something like that. So part of it is awareness through media. And especially with young women, more than men, it happens both genders, but more so with women, the unrealistic expectations that
are set in the
set
world.
in either traditional or more so new media, like social media. Because young people are bombarded by these images of perfection all the time, which doesn't really exist, or it is either a genetic fluke.
Beauty standards, basically.
Well, and most of what we see, as we know, a very small percentage is just a genetic perfection, and the majority is lots of work and surgery, right? So,
true.
And then it's portrayed as this should be the standard. Who says this should be the standard? That's not how a human being looks. But it's just accepted, whether consciously or unconsciously, as the standard, and then you get all these disorders that come with it.
So what is the most common disorder nowadays in general?
In general, worldwide, the most common group of mental health disorders are anxiety disorders.
So why anxiety is the most common disorder nowadays?
That's a great question. So part of it is biologically built into the human being. So if we go way, way back, when we were hunters and gatherers or agrarian societies, our role as human beings was to survive the elements, survive wild animals, and so on. And so our brain is built to have
survival mode?
Yeah, it's a fear thermostat, if you will.
Okay.
And there's a set point to that thermostat. What does a thermostat do? If you set it to 20 degrees Celsius, anytime the temperature goes to 21, it fires. And that's when it should fire. And so we have a fear thermostat. If you have a wild animal chasing you, then you are going to fight or flight. That's called the fight or flight response.
Yeah.
What if, because of the complexity of the brain, genetics, so on, that fear
Gets
thermostat,
triggered without
yeah, let's say
any
it's set to
noise.
17 or 16, it's going to be firing all the time.
Okay.
So that's one part. The other part is the way we live today is a very rushed existence, as you and I know very well, not even in our jobs, but even as human beings and all of our friends and families. And rarely do we as human beings today stop and smell the roses. And this
Stop and
movement
smell
towards
them.
meditation and towards pausing, I think, is an important one, because with the industrialized world and then the knowledge society and the internet society, we've become so rushed that we wake up in the morning and we're already in our first meeting at work. You might wake up and there's already 20 people with you. You're in your first meeting and you don't enjoy your first cup of coffee or your shower, and you're never in that moment. When you're driving, you're never just driving. You're thinking of something else. You're doing something else. And so that induces anxiety. Because what is anxiety? Anxiety is a constant thought or fear of something awful in the future happening, which you don't know. A way to describe anxiety is fear of the future, and a way to describe depression is regret over the past, right? And so if we're in constant fear of what's coming that we don't know, then you're always going to be anxious. And so the solution to that, other than, of course, if there's a biological problem that we need to fix chemically, is to be still, not just physically, but mentally, at different times in the day, and just enjoy the moment, smell the roses, because that brings you back from projecting into that fear of the future.
Like, I think there's a book called The Power of Now.
Yes, it's a very good book.
Yeah, it's a very good book. So, why do people confuse, depression with anxiety, with panic attacks?
Mm-hmm.
Sometimes you can even have 3 of them at the same time.
That's true.
And
Mix.
yeah, and
Which is, by the way, common in medicine, because you can have diabetes and high blood pressure, right? So it's
Yeah, right, true.
okay.
But if there's 2 major divisions in mood and anxiety disorders, so mood disorders are how you feel, right? So depression, you feel hopeless, sad, lack of interest, lack of pleasure. Whereas anxiety disorders is how you think. So anxiety disorders involve overthinking, worrying, difficulty controlling the worrying. And there's different types. So there's generalized anxiety, where you're just worried all the time. I'm just going to put it in very broad terms. There's a lot more detail. And then there's panic attacks, where you have these episodes of intense fear with physical reaction to the fear, like
Shivering.
sweating and shaking and rapid heart rate and feeling like you're choking or you're going to die. And then there's social anxiety, which is it's performance, whether it's a high level performance like giving a talk or being interviewed, or it's a performance like sitting in a restaurant and eating in front of people, or talking to a small group of people. So some people have that degree of social anxiety.
some people have panic attacks with derealization. I think it's mixed.
Yeah, that's a very technical term. I'm impressed. But derealization, so there's derealization and depersonalization. And that usually comes with anxiety. So depersonalization is a feeling that you're outside yourself, that you're outside your body, and there's something unreal about you being in your body, almost like you're observing yourself outside from a camera.
Yeah.
And derealization is a sensation that your surroundings are unreal and dreamlike. And that can happen during a panic
Even
attack.
familiar faces can seem unfamiliar.
Exactly.
Precisely.
And that can happen in intense anxiety.
Anyway,
We can go on for
I have a lot of
we
questions.
have a lot
We're
of
never
questions,
going to be over.
and we're running out of time. So I
So-
gotta thank you for your time here.
Thank you so much.
You shed an important light on mental health care, and I feel like we need to keep advocating for mental health care in Kuwait.
And I would like to have you again.
Yes.
I have
thank you.
millions
Yes.
of questions.
Millions.
It would be
of
my
questions.
pleasure. Thank you so much for having me and for shedding
you.
light on this important topic.
So, one last advice you
Yes.
would give to the audience before we wrap up?
So maybe 2 things. At the personal level, a healthy mind is in a healthy body. We all know this saying, but it's very, very true. And so mental health starts with physical health. And so sleeping well, eating well, exercising, avoiding toxic substances, having balanced relationships and, a balanced work life, that helps your mental health a lot. The second piece of advice is, if you get to the point where you need help, you should seek help. It is private. It is non-judgmental. Even in Kuwait, we have excellent practitioners in mental health, whether it's psychiatrists or therapists or social workers. The landscape really has changed when it comes to care. And whether you go to a government or private center, you're going to get good care. So I really encourage people, if you're suffering, there's no need to suffer. Reach out for help. It is there.
Thank you,
for
Doctor,
being
for
in
those
this.
beautiful words. Amazing for everything you've done here today and everything you've done in your career.
Thank you so much.
I wish you all the best.
Thank you.
We'll be right back after the wrap up. For the wrap up.
For the-
All right. Stay tuned. So we have reached the end of our episode for today from the Untold. Unfortunately, we had to end this episode. Well, I guess we vote for
A part 2.
part 2 or
Yeah.
a show.
A show about mental
I
health care,
would-
why not? With Dr. Suwaidan. That would
yeah,
be great.
we need
Let's
the-
pitch it. But let's not...
Waste time.
it
I mean, it is the end of the episode.
is the end of the episode.
We have the time.
Yes. Tune in next time, though, for more stories, more guests right here on The Untold for KTV2.
Stay healthy and good night.
Good night.